Okay, part two. Questions from Glenn.
So, you mentioned that this is useful for skin problems.
Correct.
Of all types, I would imagine.
Most all types. You want to be careful of open lesions because we're talking about oozing at this point, and you want to spray the area around because when you get the area too concentrated with damp, as you know, you can aggravate the condition. And when it's oozing, you have to pay particularly close attention. So I've even had some with open, gaping, infectious holes and closing them. And in other words, you put a cloth over that, and then even though it'll get wet, it doesn't over-ozonate or over-oxygenate the area. So you do it in a gradual way so that it's able to what? Ooze on its own. It's able to, the infection is going to come out. Now you want to, at some point, get to when the wound starts to close, start using the water directly.
Okay. And so what other kinds of conditions have you found it very helpful for? Lung problems, asthma, COPD?
Okay, excellent question. Maybe I should turn this to face me. Here, Elizabeth, you hold the phone while I talk.
Sure.
Okay. Lung disorders are some of the most quick to recognize in this because your skin is like a lung.
Right.
If you think of it as having respiration of the cells, in your body you're going to have breathing of the skin, which takes a huge load off the lungs. Shortness of breath. You mentioned COPD, asthmatics, emphysema. Now remember that you have to introduce it at a gradual enough pace so that you're not doing it too quickly, because you can cause a kind of allergic reaction in doing it too quickly with any type of oxygen therapies. But this one is the least dangerous because you're getting it in such a gradual, non-invasive way. You're producing what we refer to as an immune stimulation based on making accessible the oxygen through this respiration of the cells and the heat, creating a false fever.
Right.
No, any questions? Any other questions?
Other conditions that you found it to be unusually beneficial?
It's amazingly effective in local treatment for pain. Yeah, one of the interesting things about oxygen therapy is when it's activated, it has a remarkable ability to treat chronic pain or acute pain. It doesn't matter. It's swellings, this kind of thing. And what we're seeing is that the analgesic effect, you can literally, if you have tennis elbow, you spray it on the elbow. If you have frozen shoulder, spray on the shoulder. If you have back, take water, let it run down your back.
Yeah.
So it's really locally, you get the oxygen to the site, which is pretty amazing in that.
What about systemic infections? Hep C, Lyme, HIV, herpes, whatever.
Okay, in a general way of describing the action of oxygen is it burns up anaerobes. You're thinking of microbes, infections, bacteria, viruses. When they come into the presence of oxygen, it's high enough concentration, it deactivates them. And you're using it in this manner becomes a way of facilitating the body's quick ability to die off, kill whatever these infectious agents are, and eliminate and through all the systems that are stimulated, circulatory, lymphatic, and so on.
Cool. What about length of treatment? You set me up for 30 minutes a day. How long is the treatment range? Some people might be 5 minutes, others an hour, or
it's typically no less than 15. Even at 15 minutes, you're getting a lot. But if we can extend it in 5-minute increments, and it can stop anywhere along the way, because there's a safety button in there that stops it. If you only want it 12 minutes, you can stop it there, or 22 minutes, you can stop it there. So you can get as long of a session as you need. But the ideal is that one of the reasons why we have this over here, the heart rate, there's a heart rate monitor that is a safety mechanism, and it's measuring 114 right now. That's what your heart rate is.
Right.
And if it goes too high, the temperature comes down. So if you even get a 25-minute session, okay, and you can take a little bit longer and push it to 26, next time take it 27, and so on. We can also monitor it with your heart to make sure it doesn't go too fast.
Got it.
Okay, so there's a safety piece involved.
Is there an optimal length that you're kind of working towards?
Yes, and I've got some Olympic athletes, and what we try to achieve is your own personal goals may differ from, saying, being an athlete. You could take 25 or 30 minutes immediately. Now, you may not take the heat, you may only go 104, 105, but the healthier you are, the longer and the higher the temperature. So if you're in a diseased state, in this state of dis-ease, your body can't take on as much oxygen. But if your body's used to taking on more oxygen, we can up the ante. Usually starting off with 25 or even as much as 30 minutes.
Would you go as high as an hour?
Cannot. And I don't recommend it.
Okay.
Because then you over-oxidize. And remember, oxidation has a limit.
Right.
And that word is not a bad word. Although scientists are often misunderstanding the relationship, it's paradoxical. Because you stimulate activity at the same time of removing toxic substances in the body. The oxidative stress is looked upon as taking on and destroying healthy tissue, when in fact it's regenerative. It's turning over cells that are dying. So you want that oxidation. If you didn't have oxidation going on, you'd be dead.
Exactly.
And if you didn't have it in the proper proportion, you get diseased.
Right. Yeah.
Thank you, Dr. Warburg, by the way.
Right. Redox is essential for life.
Absolutely.
And you gotta have both, reduction and oxidation.
Exactly.
In the appropriate rate.
And that's why we're upping the ante
Yeah.
in this manner, because most people are in such an anaerobic state, low oxygen levels,
Yeah.
that they can't maintain healthy immune response, ability to respond to pain. Neurological disorders can be, addressed in this manner. Nerve damage is nerve damage, and this might be a good time to mention that when people are asking me, can you bring back, my feeling in my hand, we have to take care of some other barriers that are in the way, right? Circulatory barriers, fatigue disorders, inability to eliminate, the
Right.
blood is too full and it's dark, and then you hear I'm making it bright red. What do you think?
Right.
You're getting oxygen to the cells finally. So
Yeah.
there's the beauty of it.
So you mentioned an hour, you would never go an hour. Would you go 30 minutes is the max, or 40?
I would go 30 minutes as a
30.
max, and that means even for
Right.
the highest level of athlete, because we found that if you go longer, you create the negative effects. And I don't need to do that, but we could put you in more frequently
Right.
at the higher level. So I would do like 30-minute sessions for a very healthy person, maybe twice in a row, and maybe back it off on the third session, and skip a day.
So basically, beyond 30 minutes, what you've done is utilize the oxidative, you've strengthened the oxidative side of the equation to the point, and beyond that is past the point where the reduction side can balance that out.
Correct. And we're also, remember, doing something that no other oxygen therapy is doing, promoting the sweat,
Right.
which changes the signal, the
Yeah.
immune response. What do we do when we get a virus?
Sweat.
Sweat. And what happens to people that don't sweat? We found that every 90% or more of people that have cancer
Yeah.
don't sweat.
Absolutely. Yeah. Absolutely. I've noticed that in my career for decades.
It's amazing. It's not
Yeah.
even talked about.
Yeah, never, but it's absolutely essential part of it.
True.
Yeah.
Okay, well, that concludes part 2.
All right.